What's up, guys? Dr. Chris Park here. Uh, Welcome back. Got an interesting question for you. Should you tell your doctor that you smoke marijuana? Now, I'll say that in a perfect world, most definitely, right? That your doctor needs to know what's going on with you, needs to know your history, needs to know if you drink a couple glasses of wine a night or you're drinking, a case of beer. Um, First thing in the morning. Your doctor needs to know these things to best help you and to best get a full picture of what's going on in your life. Now, marijuana is tricky, and I currently live in a state where it's illegal. Uh, which hopefully that won't be forever. I think it's unethical that it's illegal. But anyway, that's another discussion, right? The question is, should you let your doctor know? Because what it goes in your record kind of stays with you. And other places, like let's say if you go to the emergency room and maybe you smoke marijuana once a month, but it gets put in the record, drug use, yes, marijuana, oh. And that could kind of hang with you for a while and affect your treatment. And I know this has happened to a guy that I know very well, but he had this history years ago. I mean, like, early 20s, man. He just lived that really hardcore party lifestyle, and it got kind of put in his medical chart. And so even though he hasn't used drugs in 10 years, I get these, like, if he had to go to the emergency room or something, I'm listed as a primary doctor, and it sends back, and I can see what's been put, and I just look at the social history where it says, former meth, user, or cocaine, or excuse me, whatever. And I just think, if you don't know this guy, what you might think, especially with some of the ailments that he's had, you might think it's from drug use. And a lot of folks, once they think that's the possibility, it's like their mind gets blocked from exploring any other options. And that's just, sad. But you should never falsify a medical record, and you should never give false information to your doctor. But it is kind of a conundrum. What you should do in these instances, whether that should be placed on your chart or not. And so I was just kind of curious what you guys thought. Now, look, if you're going to an addiction clinic, you definitely need to let your doctor know what drugs you use, right? And you don't need to try to pass something off. I mean, I would never, fire a patient for marijuana use. But at the same time, like, oftentimes, medical boards and rules by states kind of differ. And if you're writing controlled substances, it's a red flag when someone's using a controlled substance. And I guess there's just fears of mixing drugs and things like that, which is why the doctor should know what you're taking to make sure everything is safe. Now, again, if somebody comes to me with addiction, I don't, and they're using marijuana, it may not be in their best interest, right? Because they need complete sobriety. But it's possible that one drug might be killing them quicker than the others. And so it may be that we need to get the opiates out of their system. And it may be we need to focus on their crystal meth addiction. And it may be that, hey, maybe their marijuana use bumps up a little bit as they come down off meth. Okay. Maybe they're more depressed and they're kind of starting to self-treat some of the depression and anxiety because they had some opiate withdrawal, or because they're on buprenorphine now, and they just feel different, Maybe they're more anxious because they have all of a sudden their mind's not thinking 100% about getting pills, and they're trying to fill their head with, what do I do? They're more anxious, or maybe they have more opportunity, more money now. There's lots of things that can happen. So I feel like my job is just to be there for my patient when they need help, and not beat them over the head, demanding them to do this or do that. It's I just try to kind of help guide people. Now, but that's not what this post is about. This video is supposed to I just kind of wanted to get your guys' opinion. If you think you should tell your doctor if you smoke marijuana or not, if you feel safe. It used to be the medical record was sacred. and doctors still consider it to be sacred. And so, but it's been penetrated by the government, by insurance companies, by life insurance, lawyers. Everybody wants a piece and wants to know what's going on with these charts, and it's sad. And I don't like kind of the direction we're going. I feel like, it's one of those few places where privacy is still, kind of sacred. The doctor is one of those last people that you can just we're supposed to be able to tell anything. And I want it to stay that way. So just want to get your thoughts and opinions. I hope this video made sense, and just let me know what you think. All right, guys. We'll see you.